all of the complications, all of the death, and long-term morbidity are related to hyperglycemia and complication of hyperglycemia. How we diagnose diabetes? There is a criteria listed or issued by the WHO, called the WHO criteria for diabetes mellitus diagnosis. Diabetes, there is 2 stages called diabetic or pre-diabetic stages. The normal blood glucose, as you know, is about 70 to 120 milligram per deciliter. For diagnosis of diabetes, the random blood sugar should be more or equal to 200 milligram per deciliter. The fasting blood sugar is more than or equal to 126 milligram per deciliter. This is fasting. The 2-hour postprandial or 2-hour glucose tolerance test is more or equal to 200 milligram. هذا نسميه الجلوكوز tolerance test أو 2-hour postprandial test, in which the patient given about 75 gram of sugar in water and to be administered by the patient, and there is a regular estimation of blood glucose after half hour, after 1 hour, and after 2 hours. It should be returned to normal, or it should be less than 140. This is for normal people, non-diabetic. And where for diagnosis of diabetes, this 2-hour postprandial, 2-hour postprandial test, it will remain high after administration of 75 milligram sugar glucose, more or equal to 200 milligram per deciliter. The glycated hemoglobin, or called hemoglobin A1C, is more or equal to 6.5. This is show us the control of blood sugar through long period of time. Let us say for 3 months, previous 3 months, it should be less normal. It should be more or equal to 6.5, for diagnosis of diabetes. There's a state called impaired glucose tolerance, or pre-diabetic state. يعني أقل من diabetic, it is a pre-diabetic, and these patients are more liable to get frank diabetes than others. They should be picked up earlier for better control. Here, the fasting blood sugar is more than 110 to 126, or less than 110, بين 110 وبين 126. This is borderline. هذه borderline gap in which pre-diabetic state are diagnosed, or the more than 140 for the more than 140, but less than 20. This is for the random and for the impaired glucose tolerance also. And the hemoglobin A1C, that is the glycated hemoglobin. Here it is between 5.7 to 6.4. من تصير 6.5 صارت frank diabetes. 5.7 to 6.4. So diabetic and pre-diabetic or impaired glucose tolerance status. The most important stimulus for insulin secretion from the beta cell is presence of glucose in the blood after meal. And incretins are hormones secreted by the intestine stimulate insulin secretion from the beta cell, which are blunted in type 2 diabetes. In the peripheral tissue, insulin bind to insulin receptors and promote glucose uptake and glucose utilization after meal. So the function of insulin is to to introduce or put glucose into the cells. The metabolic changes in diabetes are all the normal metabolic effect or normal function of the insulin are affected. In fatty tissue, normally insulin increase glucose uptake, increase lipogenesis, and decrease lipolysis. In the muscle, they increase glucose uptake also, increase glucose uptake by the peripheral tissue, muscle and adipose tissue, increase glycogen synthesis, and increase protein synthesis. Whereas in the liver, insulin decrease gluconeogenesis, production of glucose, and increase glycogen synthesis, and increase lipogenesis. So insulin will when in case of diabetes, there will be destruction of these islet cells and resultant diabetes. The classification, we classify diabetes mellitus is classified into many types. شباب شنو تعتقدون which type is most common? Type 1, type 2, genetic defect insulin, beta cell dysfunction.
Type 2.
Type 2 is the most common. Type 1 ايش قد البرسنتج مالته تقريبا؟ Type 1
5 to 10%.
Yes, 10% for type 1 diabetes. Type 1, type 2 will be discussed mainly, and there are certain genetic defects of beta cell dysfunction or genetic defect for insulin action or exocrine pancreatic defect. هذا شنو علاقته شباب؟ شنو exocrine pancreatic defect؟ ليش يسوي diabetes؟ شباب
دكتورة ممكن انه يعني هو الاوكسيكراين عبارة عن يعني بروتين لايسيز، فممكن انه تسوي ديستركشن لللانجرهانز.
Yes يعني in case of acute pancreatitis, chronic pancreatitis صحيح ذكرناها سابقا.
نعم
تمام. يعني هذا نسميه secondary type secondary to exocrine defect. انت منو؟ فرحان؟
لا دكتورة همام.
انت همام. اي همام؟ همام ايش؟
همام عبد السلام.
نعم. Okay. What about endocrinopathy? What type of endocrinopathy can result in diabetes? Diabetes mellitus? ذكروا. Remember which endocrine disorder result in impaired glucose tolerance or frank diabetes?
دكتورة أكرم قالي جاينتزم.
الكوشنج سيندروم.
Yes. شنو اسمك ماما؟
نور عبد الرزاق عبد الله.
إيمان. Okay. Infections, certain infection can result in diabetes. What type of infection can result in diabetes, شباب?
Hepatitis.
Hepatitis?
دكتور الفنجل infection.
Fungal infection?
دكتورة autoimmune
بعد
viral infections مثل الكوكساكي فيروس روبيلا and so on.
تمام صفا أنتي ماما؟
أي نعم.
صف. Coxsackie and viral infection of the pancreatic islets or Coxsackie or enterovirus involving the pancreatic islets من يصير infection يصير destruction يصير T cell destruction ويصير يعني damage to the islet cells. What about drugs بالpharmacology؟ أخذتوا فد diabetogenic drugs or drugs
glucocorticoids.
Exactly. شنو اسمش أنتي؟
نور عبد الرزاق.
أيضا نور. أوكي نور. قلتي جلوكوكورتيكويد بعد شباب؟
بيتا أدرينال
السلفونيلوريز.
أكو فد دايوريتك يا دايوريتك يسوي دايبيتوجينيك. which type of diuretic؟ شنو اسمه؟
thiazide diuretics.
thiazide exactly. أنت منو؟
أنس مهيب.
أنس. thiazide بعد أكو فد certain antipsychotic drugs also can interfere with glucose tolerance.
دكتورة ممكن بيتا بلوكر.
بيتا بلوكر هي أشهر شيء الجلوكوكورتيكويد thiazide diuretic antipsychotic. Oral contraceptive sometimes, yes. Genetic syndromes associated with diabetes. أيضا genetic syndromes, many genetic syndromes اللي هي مثل ما ذكرتوا Cushing syndrome or any another syndrome associated with carbohydrate metabolism. Gestational diabetes. What is this gestational diabetes؟ شو معناها شباب؟
Diabetes occur in the second trimester of pregnancy.
Yes, during pregnancy. وبعدين يرجع للnormal after labor. But these patients are more liable to have type 2 diabetes for their next life or next time. Okay, gestational diabetes. Type 1 and type 2 different pathogenesis and different causes of in type 1 there is absolute deficiency of insulin. Absolute deficiency of insulin. Both of them, both type 1 and type 2 have carbohydrate metabolic defect for carbohydrate, fat and protein. Reduction of beta cell mass here in type 1, which is absolute, in which there is absolute deficiency of insulin secretion, autoimmune destruction of beta cells with genetic predisposition. هذول البيشنت type 1 diabetes in the percentage in which there is or severe lack of insulin due to severe or destruction or absolute destruction of the beta cell mass. The percentage of type 1 is about 10%. Without insulin, these patients develop diabetic ketoacidosis, cerebral edema, coma, and death. And the etiology is mainly autoimmune cause in which there is autoimmune destruction of beta cells. What triggered this autoimmune beta cell destruction? Is there any trigger for this destruction or autoimmune destruction of beta cells? What are the triggers?
bovine serum albumin, maybe.
Yes, but most commonly يعني اللي مذكورة هي الفيرال triggers viruses like Coxsackie virus and enterovirus can trigger immune destruction of these beta cells. Whereas type 2 diabetes, looking at the percentage, it is the most common type of diabetes in adult. The beta cells are there's peripheral resistance to insulin with inadequate response of beta cells to secrete insulin. So here the insulin deficiency is relative, and it is called also adult onset diabetes. Affect people more than 30 years of age, and they are obese in 80% of patients, mainly abdominal obesity. And they have ايش تتوقعون شباب in type 2? Is there any antibodies in the serum of the patient or anti-islets antibodies? In type 2 diabetes mellitus.
دكتور على الأغلب هو يكون غير موجود، يعني هو يعني السبب diabetes type 2 يكون combination of يعني lifestyle و genetic factor يعني على الأغلب.
تمام يعني yes there is no يعني for diagnosis of type 1 واحدة من serological finding are autoantibodies within the serum of the patient, whereas in type 2 there is no anti-islets antibodies. In type 2 there is exhaustion. يصير exhaustion of the beta cells. أول شيء يصير beta cell hyperplasia due to chronic hyperglycemia and persistent stimulation of the beta cells to secrete insulin. At late or in advance, at the end there will be نسميها beta cell exhaustion due to chronic hyperglycemia in addition to the peripheral resistance. Peripheral resistance معناها poor response of the tissue to the effect of insulin. So insulin deficiency is relative, not absolute, and it can be treated by drugs, whereas type 1 they should take insulin. So in type 1, insulin is there is absolute deficiency. Glucose unable to enter the cell is lead to hyperglycemia. The cells starve due to no glucose for energy generation. There is no glucose to enter to the cell for generation of energy. Result in polyphagia and fatigue. Glucose exceeds the renal threshold. This will result in glucose in urine, which is osmotic diuresis. So the glucose, when go out through urine, it will take water and electrolyte with it, result in polyuria and also volemia. Serum, increase in serum osmolality because of high glucose, and high volemia due to polyuria, and the symptom is polydipsia. 3 P's, the symptoms, 3 P's, polyuria, polyphagia, polydipsia. The diagnosis هو نفس الكرايتيريا اللي قلنا عليها الراندوم 200 fasting more or equal to 125 والبري-diabetic هذا هو اللي هو بين ال 110 إلى 125 من يصير 126 صار frank diabetes. والهيموغلوبين A1C هو الكنترول or indicate the glucose level through a prolonged period, let's say for 3 months, the lifetime of RBCs. The pre-diabetic status here is up to 6.4 نصير 6.5 صارت diabetic frank diabetes in young adult or children. Albumin in urine is present due to destruction or due to glycosuria can result in basement membrane destruction and or defect and passage of albumin and glycosuria, glucose in urine and albumin in urine. Autoantibodies are present or against beta cells or anti-islets antibodies نسميها GAD, glutamic acid decarboxylase antibodies. Glutamic acid decarboxylase antibodies. Insulinoma associated to antibodies, IA2A, and islet cell autoantibodies or insulin autoantibodies. Types of antibodies detected in the serum in patients with type 1 because of autoimmune destruction and autoimmune bases of type 1. And release of these autoantibody and heavy infiltration of lymphocytes indicate autoimmunity. Even the type 1 have lymphocytic infiltration, but more in type 1. The classical presentation, 3 P's, polyuria, polydipsia, and polyphagia, and dehydration due to hypovolemia and fluid and electrolyte loss, dry mucous membrane and decreased skin turgor or elasticity, dry skin, fatigue and lethargy because of hypovolemia, blurred vision also, gastroparesis. What is gastroparesis, شباب? gastroparesis من نقول paresis معناها numbness. ده gastroparesis شنو معناها؟ معناها شنو؟ diminished bowel شنو؟ diminished bowel movement مو صحيح؟ diminished bowel movement and constipation. This is part of شنو؟ نسميه autonomic neuropathy. Paresthesia also as a effect of advanced glycation on the peripheral nerve result in loss of sensation, paresthesia. Weight loss despite polydipsia and polyphagia. Mild hyperglycemia may be asymptomatic at the start. Volume depletion, symptomatic, moderate to severe hyperglycemia. Volume depletion will become symptomatic with severity of hyperglycemia becomes more symptomatic. Mucous membrane are dry and with hypotension due to hypovolemia. Diabetes mellitus type 2 is related to resistance or peripheral resistance of insulin or tissue resistance. Most common type of diabetes. The insulin resistance can be inherited or acquired. Both type 1 and type 2 have genetic predisposition, but the genes are different in both of these two types. Beta cell hyperplasia, insulin resistance, in which there is beta cell hyperplasia and hypertrophy. Beta cell will increase the secretion of insulin, result in hyperinsulinemia, سمينا قبل شوية exhaustion. Amyloid will be deposited within the beta cells. وأكو فد material أخرى اسمها amylin produced with insulin and by the beta cells to be excreted with the and accumulated outside the beta cells like amyloid. These result in beta cell exhaustion after excessive stimulation and hyperplasia, function of beta cells and atrophy and decreased insulin production with resultant hyperglycemia. So both exhaustion after long-standing hyperinsulinemia with associated amyloid deposit, which is in which amylin produced with insulin in the beta cell will be accumulated and to be excreted and with insulin result in amyloid deposit within the beta cell, result in beta cell atrophy. بس نشوفكم الصور هذه شباب دقيقة. This is a hyalinization of islets due to amylin production, which is like amyloid produced with insulin in the beta cells and excreted and accumulated outside, result in atrophy of the beta cells and beta cell dysfunction. نسميها hyalinization or risk factors. The risk factors of type 2 diabetes is multifactorial interaction between genetic and environmental and behavioral factor. Genetic factors are present, environmental factors like family history, environmental factors including and behavioral factors including physical inactivity, sedentary lifestyle, poor diet, obesity, advanced age more than 45, history of gestational diabetes, pre-diabetes. هاي الكرايتيريا اللي ذكرناها pre-diabetes اللي هي بين اللي هي not under the level of diabetes but with يعني random هو less than 200 وال 6.4 for the glycated hemoglobin, and the random is between 110 to 140. There are certain syndromes, metabolic syndromes, including or endocrine syndromes like polycystic disease of ovary. medications اللي ذكرتوها شباب اللي قلتوها glucocorticoid, diuretic, antipsychotic, and contraceptive pills. Okay. Signs and symptoms, 3 Ps, polyuria, polydipsia, polyphagia, and glycosuria. Glycosuria, presence of glucose in urine with associated weakness and weight loss, blurred vision. There is certain cutaneous manifestation or skin changes called acanthosis nigricans. Acanthosis nigricans. Dark or hyperpigmented cutaneous patches. Cutaneous changes or hyperpigmentation of the skin as a patches related to insulin resistance, tissue insulin resistance. Laboratory diagnoses are the same. نفس الشيء أيضا. Difference is there is absence of autoantibodies against islet cells or against beta cells. No antibodies in type 2 diabetes. The complications شباب for both type 1 and type 2 are the same, تقريبا the same, and are related to long-standing micro and macrovascular disorders. Increased risk of infection. Diabetes mellitus is one of the disorders affecting immunity. Increased risk of infection, delayed wound healing and repair, increased risk of amputation. Most common cause of amputation in the world هو diabetes, type 2 diabetes or diabetes in general. Diabetic ketoacidosis, not ketosis, ketoacidosis. It is more common in type 1 or type 2 شباب. Diabetic ketoacidosis.
Type 1.
Type 1.
Yes, exactly. Type 1. Type 1 is more diabetic ketoacidosis, in which there is breakdown of fats and ketone bodies will be in excess in the blood. It will result after any hyperglycemia for about more than 250 milligram per deciliter, ketonemia and ketonuria, and metabolic acidosis. The blood acidity, the blood pH will be lowered. Diabetic ketoacidosis اللي هي very serious with associated cerebral edema, coma, نسميه diabetic أو diabetic coma, cerebral edema and death can be complicated. Neuropathy شباب, neuropathy either autonomic or somatic. Autonomic هسه قلنا واحدة من الأوتونوميك neuropathies اللي هي كانت شنو سميناها؟
Gastroparesis.
Yes, gastroparesis and constipation. بعد شباب autonomic يعني visceral neuropathy. شنو يصير عندهم الدايابيتك؟ شو يصير عندهم؟ يصير عندهم paralyzed bladder، مو صحيح؟ يسموها autonomic أو يعني يصير عندهم urine retention due to يعني أيضا peripheral neuropathy affecting the wall of the urinary bladder. So attacks of constipation and urine retention. What about somatic neuropathy? Peripheral neuropathy in the extremities, mainly in the lower extremities. Exactly. So microvascular abnormalities or microvascular changes affecting the vessels of the retina and the kidney, and called diabetic retinopathy and diabetic nephropathy. Whereas the macrovascular changes, cardiovascular changes, including myocardial infarction, thrombosis, cerebrovascular accidents, and ischemia, and peripheral vascular disease. So put in mind, most common cause of death in patient with diabetes is, you know,
atherosclerosis.
Yes, myocardial infarction, cardiovascular, اللي هو macrovascular changes. Most common cause myocardial infarction, the most common cause of most common cause of death in diabetic patients.
دكتورة بس سؤال، الريتينوباثي شلون يسبب لك الريتينوباثي؟ يعني قصدي ليش؟
هسه احنا راح نجي نفصلها بالتفصيل الريتينوباثي، بعد احنا ما شرحناها هسه بالتفصيل. واذا عندك سؤال ورا التوضيح من فضلك. Regarding the general pathogenesis of type 1, قلنا type 1 هو autoimmune basis. There are heavy lymphocytic T cell infiltrate of the islets with beta cell destruction and antibodies detected within the serum develop in childhood. Okay, and the principal immune abnormality is failure of self-tolerance in T cell specific for beta cell antigen, and so they destruct or they interact or attack the beta cell antigens. Autoantibodies are detected again in about 70%. يعني high percentage of autoantibodies detection in type 2, type 1 is detected in 70% of cases. 70% of cases. لهذا هم مرات يقولون of unknown cause type 1, of uncertain cause. لأن أكو 30% شباب they not detect autoantibodies in the serum. Whereas type 2, the metabolic defect in type 2, there is decreased the peripheral sensitivity or response to insulin, called insulin resistance. and beta cell dysfunction or beta cell exhaustion أو destructed by the اللي شفتوها هسه البروسيس with the secretion of with the hyperplasia, prolonged hyperplasia of beta cells to secrete insulin. There is amylin production, which is like amyloid to be deposited extracellularly and causing beta cell atrophy or halalization. Beta cell dysfunction, inadequate insulin secretion. يعني أو after exhaustion راح يصير inadequate insulin secretion. أول شيء يصير hyperinsulinemia وبعدين يصير due to hyperplasia وبعدين يصير exhaustion and hyperglycemia, failure of control blood sugar. So insulin resistance precedes hyperglycemia with compensatory beta cell hyperplasia and hyperinsulinemia in earlier stages. هاي hyperinsulinemia وبيتا cell hyperplasia هذه in earlier stages بعدين يصير يعني blunting أو يصير exhaustion to these beta cells. So يصير hyperplasia to compensate for the deficiency. مثل شنو مثل هذا شنو الكومبنساتوري مثل يا ميكانيزم بالاندوكراين أخذناها compensatory hyperplasia. ها شباب؟
دكتورة جويتا
ثايرويد.
يس دي شنو سميناها؟
شنو هي دكتورة الموست كومن يعني تايب؟
اي شنو سميناها الكومبنساتوري هايبربليزيا يعني شو تصير شلون تصير؟ due to what؟
دكتورة بالثايرويد ستيميوليتنج هرمون ديسفشنسي صار من البيتيوتري بسببها فيصير هايبربليزيا بالثايرويد جلاند.
Yes, there is uneven stimulation. واحدة من الfollicles أو some of the follicles are more responsive to the effect of TSH. ويصير hyperplasia for شنو حتى to compensate the deficiency of T3 T4 thyroid hormone within the serum. قسم منها يعني atrophic قسم منها parts of the thyroid are high show if يعني features of hypothyroidism and colloid goiter, non-toxic goiter, whereas the other follicles try to compensate for the deficiency of thyroxine, okay, thyroid hormone. Here نفس الشيء beta cell نسميها beta cell hyperplasia at the earlier stages. بعدين يصير failure. Environmental factors هذه environmental factors sedentary lifestyle obesity poor diet وغيرها. Infection by certain viruses like mumps, rubella, Coxsackie viruses. هذه viral infection can destruct the islets and worsen the picture. Maybe initiating trigger because of similarity to beta cell antigen, the viruses. And intestinal dysbiosis أكو فد criteria اسمها intestinal dysbiosis. Change الintestinal flora, bacterial intestinal flora are very vital, important for the process of digestion and absorption. Intestinal dysbiosis, change in the composition, in the component, in the number and abundance of these bacteria or flora can be interact with, can causing in some way type of diabetes, and it can act and effect of glucose impairment. Development of type 2 insulin resistance is associated with obesity, again, abdominal obesity, in which is induced by adipokines, free fatty acids, and chronic inflammation in adipose tissue. So, adipokines, free fatty acid, and can be, or they are adipokines that are inflammatory cytokines secreted in the fatty tissue with the resultant chronic inflammation in the adipose tissue. With the resultant insulin resistance, tissue resistance. Beta cells compensate for insulin resistance by hypersecretion also, and follow up by beta cell failure. ما يخالف للرجوع من التكرار. Repetition is to stand off the informations and to fix the informations. Insulin resistance again is failure to inhibit endogenous glucose production in the liver, high fasting blood glucose, low glucose uptake, insulin resistance. عكس الانسولين effect اللي هي قلنا الانسولين, the main function of insulin is increase glucose uptake by the peripheral tissue, muscle and fatty tissue, and glycogen synthesis, increase glycogen synthesis in the muscle and in the liver. All of these are inhibited after meal. High postprandial blood glucose. شباب, high postprandial blood glucose يعني شنو؟ يعني blood glucose
after meal.
Yes, postprandial يعني after meal. يعني after meal blood glucose will remain high. It will not be lowered, not introduced into the cell by the effect of insulin. High postprandial نفس هذا اللي نسويه اللي يقولون عليه الجلوكوز tolerance test أو يعني postprandial test. Failure to inhibit hormone sensitive lipase in adipose tissue result in secreting or circulating free fatty acid that worsen the picture of insulin resistance. Again, type 2 is a complex, multifactorial, genetic, environmental, sedentary lifestyle, dietary habits, bad dietary habits اللي تعرفوها ماكو داعي نذكرها, الشوغر والفاست فود والهاي كالوريك يعني هاي اللي هي unhealthy food والobesity exercise, the decreased exercise, and in addition to the genetic factors. Genes linked to genetic factors in type 1 and type 2 are different genes, not linked to genes of immune tolerance, and autoimmunity is lacking, that are a feature of type 1 diabetes. So again, in type 1, there is effect of T lymphocyte, CD8 T lymphocyte reacting against the beta cell antigen in the pancreatic islets. So inflammatory infiltrate, the process called called insulinitis or islet cell destruction by autoimmune process by T cell, CD4 T cells. Whereas the type 2, whereas regarding type 2, the diet, lifestyle, so environmental, genetic, and factors, there, in addition to the insulin resistance, decrease the sensitivity of peripheral tissue to insulin uptake. So the beta cells are unable to adapt for long-term demand of insulin. Next, there be a beta cell failure or exhaustion. This is a picture showed the what we call insulinitis. شوفوا شباب, heavy infiltration or heavy infiltrate surrounding the islets of Langerhans here. شوفوا هذه شنو هذه الدوتس. This is the exocrine pancreas. هذا الexocrine pancreas, and this is the endocrine part, islets of Langerhans infiltrated by CD4, CD8 cells, impaired self-tolerance, the body will attack its own antigens, beta cell antigens. A viral antigen or viruses can trigger this immune-mediated beta cell destruction. Insulinitis وهذا هو الhyalinization أو amyloid deposition in patient with type 2 diabetes. Result in beta cell pressure or beta cell atrophy and affect the insulin production. Islets of hyalinized, islet of Langerhans. شوفوا شكلها هذه يصير شكلها in diabetic patient. Hyalinized islets of Langerhans. Pathogenesis شباب احنا اللي يهمنا أكثر شيء هو الجينيسيس. Pathogenesis is crucial in our subject. Advanced glycation اللي هي من عدها اللي هسه الطالب هسه قبل شوية سأل اللي من from these ways of pathogenic pathways. Through these pathogenic pathways, the retina or we will have all the microvascular and macrovascular changes and disorders and long-term complication and death even. Advanced glycation, activation of protein kinase C and intracellular hyperglycemia. The advanced glycation, there is an intracellular glucose-derived precursor with intracellular and extracellular proteins. The glycated protein after exposure to hemoglobin to high serum glucose cause increase in the reactive free radicals. Glycated hemoglobin, glycated means related with glucose effect or glucose exposure to the hemoglobin is exposed to high level of high serum glucose, result in increase the reactive free radical inside the RBCs. Free radical reaction will be increased within the RBCs, so there will be change in the RBC cell membrane. Change in the RBC cell membrane as a result of this reactive oxygen species or reactive free radicals. So the change, when there will be change in the membrane, there will be change in the cell properties, exchange and of electrolyte and nutrients. RBC will be aggregated like clump, RBC aggregation, clumped or agglutinated. Increase in viscosity, there will be من تجمع الRBCs شباب, there will be increase in viscosity and impaired blood flow. When you say increased viscosity, there is liability for thrombus formation, liability for attachment to the with atherosclerosis. So there are changes result in the cell membrane of the RBCs, result in red blood cell aggregation or clot formation, and increase in the viscosity, نزيد the viscosity of the blood. There will be impairment of blood flow and formation of thrombus and its complication. نسميها microangiopathy. Release of pro-inflammatory cytokines in the macrophages. There will be stimulation and release of pro-inflammatory cytokines, in the macrophages, and increase in the procoagulant activity of endothelial cells. The endothelial cells and the microcirculation and the microvascular and macrovascular, there will be increase. So there is changes in the cell membrane of RBCs. Release of stimulation, when you say هذا aggregation, there will be stimulation of pro-inflammatory cytokine also as a result of elevated glucose in the serum. The macrophage secreting inflammatory cytokines and also increase in material that act the procoagulant activity or the activity of the endothelial cell to form a clot or to form a thrombus. Proliferation of the vascular smooth muscle cells. Proliferation of the vascular smooth muscle cells. من يصير proliferation شي يصير شباب of the vascular smooth muscle cells. Proliferation of the vascular smooth muscle cells.
increase blood pressure.
يعني the lumen will be narrowed. The vascular lumina, microvascular lumina will be narrowed. يصير obstruction ويصير thrombosis. مو صحيح؟
trigger endothelium destruction because of the high blood pressure and cause underlying fibrosis to expose to the blood, which is thrombogenic.
اسمك ابني؟ تمنو ماما؟
محمد عبد الله.
محمد عبد الله. اللي يجاوبون اللي يجاوبوني وما أسألهم خلي يقولوا لي أسمائهم مرات الأصوات تشابه. Put in mind or recall the criteria of virtue trade. شباب procoagulant or coagulation for formation of a thrombus. هاي دائما خلوها ببالكم. Virtue trade, the basis of thrombus formation. What are the اللي هي شنو هي اللي نسميها virtue trade? 3 factors increase the procoagulant activity within the circulation. شنو هي؟ خدوها بصف ثاني hemodynamic disorders. Virtue trade 1 2 3 شنو هي؟ شباب virtue trade.
You mean the thrombogenic factors? Fibrinogen?
أكو criteria 3 criteria increase the possibility of thrombus formation within the circulation. شنو هي؟ virtue trade. يلا هسه حتى لو بالجوجل يسوون سيرش هم كان طلعت. خلوها دائما ببالكم. هذه هي الفيرتشو ترايد اللي هي شنو 3 criteria. مثلث هيك يرسموه على شكل مثلث. شنو هي هاي حافات المثلث؟ شباب شطار صفا. فرحان.
دكتورة يمكن increase بالليبيدز الهائل low density lipoprotein stasis of the blood flow and decrease in the lumen of the blood vessel.
virtue tried 3 criteria. شنو هي؟
دكتورة blood vessel activation of blood coagulation. وvein damage.
نعم.
venous stasis activation of blood coagulation protein.
stasis activation of this protein. So intracellular hyperglycemia will activate protein kinase C production and pro-angiogenic molecule as so activation of this protein kinase C by the hyperglycemia will result in what? Result in production of pro-angiogenic molecule as vascular endothelial growth factors. هذا الvascular endothelial growth factor will stimulate new vascular budding أو نسميه new vascularization in diabetic retinopathy. Stimulation of protein kinase C result in or activate the production of pro-angiogenic يعني شنو؟ يعني يسوي new blood vessel، يسوي new blood vessel budding مثل granulation tissue. اسمه vascular endothelial growth factor، يسوي proliferation للvascular endothelium by the activation of protein kinase C. And diabetic retinopathy and pro-fibrogenic molecules, pro-fibrogenic, fibrogenic, excessive or proliferation of fibroblast, transforming growth factor beta. هذا transforming اسمه transforming growth factor beta. هذا stimulation or growth factor for fibroblastic activity, result in deposition of fibroblast, excessive deposition of fibroblast within the extracellular membrane and basement membrane material, بالnephropathy, بالglomerular basement membrane, or in the extracellular يعني extracellular membrane إذا نسميها mesangial sclerosis هسه نشوفها. intracellular hyperglycemia in the nerve and the lens and the kidney and in the blood vessels. Disturbances in the glutathione production. Glutathione is important antioxidant, reduces cellular hyperglycemia. So this will result in oxidative stress mainly in glucose neurotoxicity. Disturbance of this type of antioxidant, glutathione production, will result in oxidative stress. يعني من يروح هذا الانتيوكسيدنت when there is disturbance of production of this antioxidant, result in oxidative stress or oxidative destruction of the cells, mainly in glucose neurotoxicity, peripheral neuropathy, okay, and in the retina and in the lens, and so on. So the pathogenesis of complication of diabetes, the most important cause of complication is lesion involving the blood vessels, whether in the lens, in the kidney, in the heart, blood vessels, macrovascular disease result in MI, stroke, lower extremity gangrene, and microvascular disease result in retinopathy, nephropathy, and neuropathy. Microvascular disease result in retinopathy, neuropathy, and nephropathy. مثل ما قلنا advanced glycation, protein kinase C activation, oxidative stress. هذولا will result in these microvascular disease. The long-term complication is multifactorial, but glucotoxicity is the key mediator. هذه اللي قلنا عليها نسميها glucotoxicity. Advanced glycation, activation of protein kinase C, and oxidative stress result from intracellular hyperglycemia. The pancreas, there will be reduction in the number and size of islets, leukocytic infiltration in type 1 and 2, whereas amyloid مثل ما شفتوا بالصورة شباب هسه الاميلويد deposition is a feature of long-standing type 2 diabetes. شلون يصير؟ شلون ذكرناها؟ الاميلويد there will be production of amylin or amylin which is produced with insulin. نفسها البيتا cells من تسوي insulin أيضا they produce amylin which will be excreted and accumulated outside the beta cells. They are causing atrophy and of these beta cells with beta cell failure. Diabetic macrovascular disease. Macrovascular معناها effect of diabetes on large vessels, يعني large or medium sized. Accelerated atherosclerosis is very common. in the aorta and medium-sized arteries. هذه اللي نسميها الأورطة يعني large size والmedium sized arteries renal artery والmesenteric artery هذول medium sized. Myocardial infarction causes by coronary artery atherosclerosis, the most common cause of death in diabetes. And hyaline arteriolosclerosis, this can be seen in diabetes and not specific for diabetes, can be seen also in when can be seen here هذا وين نشوف أيضا. It's not specific.
hypertension.
Yes, also for hypertension. والother type of arteriolosclerosis شنو اسمه اللي هو specific for hypertension. The other types of arteriolosclerosis are of two types. هذا اللي هو less severe الهايلاين والmore severe اللي هو associated with malignant hypertension.
malignant
يكون الجانجرين اللي يصير بالlower extremities.
اي ماما شنو اسمه الارتريولوسكلروسيس شنو المورفولوجيكال description مالته شنو اسمه؟
دكتورة هايبربلاستيك arteriosclerosis.
Hyperplastic, yes, hyperplastic. There is proliferation. نعم ليش نسميه hyperplastic? Because of proliferation or hyperplastic proliferation of smooth muscle cells within the wall. وش سمينا؟ onion skinning. وسمينا onion skinning. Okay. So it is not specific. Hyaline arteriolosclerosis not specific for diabetes. It can occur in many other chronic diseases like hypertension, diabetic microangiopathy, diffuse thickening of the basement membrane, weakening of capillaries that are leakier to plasma proteins result in development of retinopathy, nephropathy, and neuropathy. Diabetic microangiopathies. There will be defects or thickening in the basement membrane, diffuse thickening of the basement membrane due to deposition or stimulation of extracellular material deposition. Weakened capillaries. The capillaries becomes weak and more leaky to plasma proteins. Result in development of retinopathy, neuropathy, and nephropathy. Shabab, the diagram show or summarize the effect of diabetes stroke as a type of cerebrovascular accident or thrombosis. The eye can be involved by retinopathy, cataract, glaucoma, and even blindness after retinal detachment. Coronary artery disease, the most common cause of death is myocardial infarction. Gastroparesis as a result of autonomic neuropathy. Islet cell loss or islet cell destruction. By what? By lymphocytes, infiltrating T cell lymphocytes. Peripheral vascular atherosclerosis, micro and macrovascular thrombogenic changes, gangrenous changes due to the long-term effect of microangiopathy, and also neuropathy, erectile dysfunction. This is also one of the changes from vascular due to vascular or microangiopathies, impaired blood supply to the male genitalia, infection, liability to infection because of poor blood supply, poor circulation in the periphery, and loss of sensation and lowered immunity. Neuropathy peripheral neuropathy can be manifested as peripheral paresis, numbness, and loss of sensation, peripheral neuropathy, neurogenic bladder, and urine retention is also a cause of peripheral neuropathy, autonomic neuropathy, nephropathy, atherosclerosis, dermatopathy. شنو شباب ذكرنا هسه dermatopathy أو skin changes in patient with diabetes.
Pigmentation.
نعم. شنو سميناها pigmentation؟ منو أنت ماما؟ صفا؟ لا منو؟ قولوا أسماء. هايوم؟
ماريا غانم.
ماريا.
هو يصير باتشي.
Yes. شنو سميناها؟ acanthosis. Yes, acanthosis nigricans, patchy pigmentation in diabetic patient. زين بعد another skin change. كنا decrease skin elasticity and turgor. مو صحيح؟ dry skin. مو صحيح هيك قلنا؟ increase skin bruising. Okay. Hypertension. ليش يصير hypertension شباب in diabetic patient؟
دكتور لأن يصير هايبرفوليميا.
hypervolemia.
أي بسبب إنه شو
لا.
اسمه
What about يعني macro and micro angiopathic effects? increase يعني narrowing والthrombogenic activity والRBC aggregation. هذه أهم. thrombus formation.
دكتورة عفوا بس الثرومبس فورميشن مو يصير بمكان يعني يأثر على الجسم كله. إذا يصير بالرينال أي هذا يسبب لك الأثيروسكليروسيس وهايبرتنشن، بس بحالة الهايبوأوزمولر ستيت هم راح يصير هايبرتنشن.
اي خالف احنا دا نقول على الموست كومن كوز of or long standing complication هو المايكرو and macro angiopathy. macro angiopathy قلنا عليه الموست common cause of death هو الكوروناري يعني artery stenosis and myocardial infarction، وياها ايضا هاي advanced glycation, exposure, long standing exposure of hemoglobin to glucose and rupture of the cell of the RBCs and aggregation and stimulation of intravascular coagulation and small يعني هذه procoagulative activity. Diabetic nephropathy in the kidney, glomerular lesion, glomerulosclerosis or basement membrane deposition and hyalinization, arteriolosclerosis affecting the glomerular artery, renal vascular changes هذه اللي قلنا عليه medium يعني medium sized vessel renal artery can be involved by thrombosis, stenosis, atherosclerosis. Pyelonephritis ليش يصير عندهم pyelonephritis شباب؟ الدايابيتيك have high incidence of pyelonephritis and necrotizing papillitis. ليش يصير عندهم هذولا؟ ليش يصير عندهم diabetic؟ ليش يصير عندهم chronic pyelonephritis؟ repeated attacks of urinary tract infection, renal infection. ليش؟ What is the cause of pyelonephritis in diabetic patients?
دكتورة هايبر جلايسيميا.
اي ادري صحيح الهايبرغلايسيميا يعني هم in general diabetic patient have an increased incidence of infection. مو صحيح؟
نعم.
يا هي الانفكشن قلنا هم يصيرون lowered immunity و poor response أو poor healing أو impaired wound healing و impaired repair و impaired هذا ال sustained hyperglycemia يعني it is against proper healing and anti-inflammatory activity. So pyelonephritis is one of the causes of increase, or one of the presentation of increased infection in patient with diabetes. بعد شو يصير عندهم diabetic patient. هسه بالكوفيد هم واحد من الريسك فاكتورز for the يعني progression to severe disease، صح لو لا؟ دائما هم
الهايبوتنشن لما ماكو ريتنشن يصير.
دقيقة، دائما diabetic patients are at increased risk of infections، وهاي الانفكشنز ممكن تكون viral، ممكن تكون bacterial، ممكن تكون نيمونيا. ما أخذتوا بالريسبيراتوري diabetic patient are at increased incidence of pneumonia. هو immune compromised people. Diabetic patient are immune suppressed people. وصحيح؟ diabetic بعد شنو يصير عندهم؟ ممكن إذا شو يصير عندهم diabetic؟ هواي types of infection can be or can be يعني increase in incidence in diabetic patient. Tuberculosis مو صحيح؟ tuberculosis زيد بالpatient with diabetes. بعد البايلونيفرايتس، الUTI، السكين infection مو صحيح؟ all of these are at يعني the diabetic patients are at increased incidence of infections. واحدة منها هي البايلونيفرايتس and necrotizing papillitis. Necrotizing the renal papillae will be sloughed and necrotized and sloughed into the urine. Diffuse mesangial sclerosis due to deposition of basement membrane material and hyaline material and increased سميناها الفايبروجينيك أو fibro transforming growth factor beta and pro-fibrogenic activity. Nodular glomerulosclerosis أو نسميها كامل-شتايل ويلسون lesion. هسه أشوف لكم إياها هذه بالسوري. Yes. Nodular glomerulosclerosis. Nodular glomerulosclerosis. Nodular لأن الجلوميرولوسكلروسس أو فايبروسس هو يعني فوق مالتي فوكال، هنا نوديول وهنا نوديول. And diffuse or basement membrane. شوفوا this is a basement membrane thickening أو basement membrane sclerosis and this is the nodular sclerosis أو الاسم الآخر هو كامل-شتايل ويلسون lesion. كامل-شتايل ويلسون lesion indicate nodular glomerulosclerosis. هذا الليجن هو يعني specific أو pathognomonic أو يعني specific for diabetic retinopathy. Regarding the ocular manifestation or ocular complication, retinopathy, cataract, glaucoma, proliferative changes أو proliferative من نقول proliferative معناها activation of شنو سميناها تونا new vascular budding أو vascular endothelial growth factor increase endothelial cells تقوم تطلع هذا اللي نسميه vascular endothelial growth factor. من يطلع يزيد هذا they have the ability to produce new vascular budding or new capillary budding, new vascularization and fibrosis and non-proliferative retinopathy. Proliferative معناها formation of vascular أو new vascularization، والnon-proliferative هو الإديمة والهيموريج والإكزوديت والمايكروانيوريزم والvenous dilatation, thickening of the retinal capillaries, retinal detachment, and cotton wool spots. Cotton wool spots اللي هي new يعني due to damage to the يعني swelling of the يعني nerve. Cotton wool spots, puffy white patches on the retina, they caused by damage to the nerve fiber. Cotton wool spots هذه cotton wool spots, damage to the nerve ending, nerve fibers. Cotton wool spots هذه hemorrhages الإكزوديتس. This is هي retina as it is seen by the fundoscopy. This is the normal retinal picture, and this is the retina in the patient with diabetes or diabetic retinopathy. So cotton wool spots are puffy white patches on the retina. They are caused by damage to the nerve fibers. Swelling of the nerve fibers on the surface of retina due to reduced axonal transport and accumulation of intracellular products within the nerve because of ischemia. Hemorrhage is more prominent here, and cotton wool spots and hemorrhages and exudates. Microaneurysm can be seen. Microaneurysm معناها dilatation of the wall of the retinal vessels. Cataract is also one of the complications of diabetic of the ocular manifestation. Diabetic neuropathy, peripheral neuropathy, and autonomic neuropathy. Peripheral neuropathy manifested as loss of sensation and with repeated trauma even result in gangrenous changes, and peripheral neuropathy and paresis also. Autonomic neuropathy, it is manifested as neurogenic bladder with retention of urine, neurogenic bladder, and gastroparesis and loss or diminished bowel movement and constipation, and diminished erectile movements in male genitalia. Charcot arthropathy of the left ankle, Charcot arthropathy due to lack of sensation. Peripheral somatic neuropathy, lack of sensation. The joint will have repeated microtrauma due to lack of sensation, lead to bony destruction and this malformation and deformity. Neuropathic ulcer also related to loss of sensation, loss of sensation and paresis or paresthesia, and loss of sensation due to peripheral neuropathy called neuropathic ulcer, common in diabetic patients, with associated impaired healing or delayed wound healing. Atherosclerosis affecting large vessel and medium-sized vessel, aortic arteries, coronary arteries, mesenteric arteries, and even renal arteries. Atherosclerosis result in narrowing of the lumen, possibility of microangiopathy, hypertension, and thrombus formation. This is a large thrombus or atherosclerotic plaque within the lumen of the artery, result in severe narrowing. Nephropathy, nephrosclerosis, and severe cortical scarring, and هذا اللي سميناه احنا necrotizing papillitis after pyelonephritis. Nodular glomerulosclerosis are called Camel-Style Wilson lesion, in addition to the glomerular basement membrane thickening. Glomerular basement membrane thickening here is seen by the electron microscope. Mesangial fibrosis, excessive fibrosis due to profibroblastic inflammatory cytokines. Sclerosis هذا الترايكروم الأزرق هذا يصبغ الفايبروبلاستيك tissue collagen. One of the complication or severe complication of diabetes, especially the type 1 diabetes, is the diabetic ketoacidosis, which is a medical emergency due to cell starvation, result in altered mental status. It can be precipitated by stress condition or infection in patient with poorly regulated glucose. There will be shifting of or breakdown of fat and ketone bodies in the blood. Epinephrine and stress will result in glucagon and lipolysis. So result in lipolysis, and which this will increase the free fatty acid within the blood and production of energy or ketone bodies, and that are acetoacetic hydroxybutyric acid will increase the blood acidity, mainly in type 1, and in long-standing type 2 with uncontrolled blood sugar, and when the body completely stops to produce insulin in advanced stage. The complication of diabetic ketoacidosis is cerebral edema, acute cerebral edema. High glucose result in osmotic shift of water to the extracellular fluid, and hyperkalemia, and exchange mechanism in regulating acidosis and result in arrhythmias. Signs and symptoms: severe dehydration, nausea and vomiting, and mental status changes, deep breath or deep breathing to get rid of excess acetone, and acetone breath, ketone bodies break down into acetone to be secreted as gas through the lung. Dehydration, nausea and vomiting, and mental status changes due to cerebral edema, and deep breath to get rid of excess acetone, acetone breath from the mouth, and ketone bodies that are break down into acetone, secreted as gas through the lung. Laboratory test: hyperkalemia, more than 5.3 milligram per deciliter, glucose more than 250 milligram, and acid-base status, there is increase in blood acidity, and ketone bodies in urine. Okay, any question? Tumors of endocrine pancreas, islet cell tumor, beta cell tumor called insulinoma, alpha cell tumor called glucagonoma, and delta cell tumors called somatostatinoma. Gastrinoma is a pancreatic tumor, result in producing Zollinger-Ellison syndrome, excess gastrin and excess gastric acid production. شباب اللي عنده سؤال لو ننهي المحاضرة كيفكم؟ أكو أحد عنده سؤال شباب من فضلكم؟ الباثولوجي ركزوا على الباثوجينيسيس وال يعني disease evolution، وهذه يعني اللي تهمنا احنا ما ندرسكم تريتمنت ولا. أكو سؤال؟